Hi, I'm Brandy G, the Community NP.
And I'm Brandy B, also the Community NP.
And today we're going to be talking about breast cancer awareness. October is Breast Cancer Awareness Month, B. Yeah. So it's by right that we talk about breast cancer this month.
That's right.
Okay. So we're going to get started here.
What is breast cancer?
So breast cancer is a disease in which abnormal cells in the breast grow out of control.
Okay.
A couple other facts about breast cancer. It's one of the most frequent type of non-skin cancers, and it's the most frequent cancer that's caused by death in women worldwide. It's the second most frequent cause of cancer death in women in the United States.
And then, men can also get breast cancer. It's not as common, of course, but it can happen. And then the people that are more likely to die from breast cancer are African Americans, although Caucasian women are more likely to develop breast cancer. Research has shown that Black women or African American women are more, they develop a more aggressive type and it's usually diagnosed at a later stage, and they're more likely to die from it. So, B, why do you think that it's diagnosed at a later stage?
Probably access to care.
Yeah, I think so.
I really think access to care is probably access to care. Of course, insurance. I think that plays a role in African American women not being diagnosed at an earlier stage.
Yeah, I agree.
Yes,
I agree.
So, who should get screened?
So all women from ages 40 to 75 is the guidelines. That's who is recommended to be screened every year. And then, of course, women with family history or like genetic links to breast cancer, they usually get screened earlier. You just talk to your PCP or your gynecologist and see what the recommendation is.
Okay, some of the risk factors of breast cancer, of course, females, we have more breast tissue than most men.
Yeah.
Okay. Age 55 and older. As you get older, you start becoming more susceptible to chronic illnesses and other diseases also. So that's why 55 and older. Like you said, family history, a first degree relative. So your mom, your sister, your daughter, that puts you doubles your risk of getting breast cancer. Genetics, genes passed from parent to child. A personal history of breast cancer. So if you have a history of breast cancer, you're 3 to 4 times more likely to develop breast cancer again.
Yep.
People who had some radiation treatment before the age of 30, maybe from some other illnesses that they may have had and had to get radiation. Any other people, B?
Yeah, so even if you have like a prior history of other breast conditions that weren't necessarily cancerous, but you had problems with your breast, then that also puts you at risk for developing breast cancer. And of course, obesity. Women who...
they had their first child after age 30.
Then,
they're more likely at risk for getting breast cancer.
Right. And then if you start your cycle before 11 or you have menopause after 55, then you're at increased risk. So early menstruation or late menopause. If you've had hormone replacement therapy, if you drink alcohol, and you can drink alcohol in moderation, but you don't want to drink a lot of alcohol every day because that will put you at an increased risk. And then women with dense breasts are more susceptible of developing breast cancer if you live a sedentary lifestyle and if you smoke. It also puts you at increased risk.
So there's 3 things on this risk factor list that just stick out to me because we have done 2 other videos previously, and it was hypertension, and we also did colorectal cancer. And the risk factors with those, and also with breast cancer, I saw obesity, alcohol, and smoking.
Yep.
So if we can get a handle on those things, maybe we can live healthier lives.
Yeah, decrease your risk for a lot of things.
Yeah, so I just wanted to make that point.
So, how often should you get screened?
Yearly. I would say yearly. You should get screened at least every year.
Yeah.
Mammograms are preferred. I know that the American Cancer Association does not recommend clinical breast examinations. That's when your primary care doctor
Mm-hmm.
may do an examination on you while you at the clinic,
Mm-hmm.
for like your annual exams. And they don't really recommend self breast examinations. But I would have to say, you know your body. I think you'll be the first person to be able to figure out if something's abnormal with your breast. So I do recommend it. And my patients still feel on their breasts.
Yeah, I do too.
And if they feel anything abnormal, please to notify me so we can get the needed testing done, especially a mammogram or ultrasound, whichever needs to be done.
Yeah. So, B, what's the reason that they're saying not to do the clinical breast exams and the self breast exams?
So the reason why is because they were seeing a lot of false negatives. So saying false negatives meaning that they may find something and it causes them to get a biopsy done.
Yeah.
And once they get the biopsy done, the biopsy comes back negative. So therefore, the person has been exposed to having a biopsy, which makes you have abnormal breast tissue, probably after your biopsy. So therefore, you get a lot of false negatives. You may think you see something that's really not there.
Yeah. So then you're spending, you're using your insurance and it's just basically you're wasting a lot of money. So I think that's why, part of the reason why they're recommending not to get the exam done.
Okay. What happens when you get a mammogram?
You got one done recently.
I did. I'm going to tell you. So we're going to see if what's out there in cyber world is the same or what happened. Okay, so I went in and the radiology tech, she asked me to go ahead and take my clothes off all the way down to my waist. She gave me a little hospital little robe to put on. But she made me wipe all my deodorant from underneath my arm. Okay. So she gave me a little wipe. I wiped my deodorant from underneath my arm. She softly took my breast and placed it in her on an X-ray exam table, in which the X-ray exam table it did press down on my breast both ways, sideways and up and down. And while she was doing it, she asked me to stop breathing. To hold my breath, like hold your breath until the X-ray is finished. So I held my breath, and she did both breasts.
Okay. So is that basically what the guidelines say are supposed to happen?
Yeah. Yes.
So they did a good job.
They did.
You would recommend them?
Yes, sir.
Okay.
Yes.
Yeah, that's pretty much. I had a mammogram when I was much younger.
Why was that?
Well, I did a self breast exam and I had noticed a knot on the side of my breast, and so I notified my OBGYN doctor and they sent me for a mammogram. I was only like 28 or 29, but anyways, it was a benign growth, so I chose. They offered me to get it biopsy, but I chose not to. So that just kind of goes back to sometimes they recommend biopsies and you get false positives and stuff. But anyway, so I just monitor mine and make sure that the size doesn't change, which it hasn't. So, but yeah, I went through the same process and I think that's pretty standard.
Okay, so even though I'm gonna be honest with you, it was uncomfortable, but it didn't last long at all.
That's true. Yeah.
It only lasts I say 5 minutes. It didn't last long, 5 to 10 minutes. Yeah. But it didn't last that long. So even ladies, it is uncomfortable, but it's doable. It does not last long.
And it's worth it because, I mean, if it leads to detecting cancer, which we always hope that's not the case, and, the earlier it's detected, the quicker you get treated and the more likely you are to survive.
So when shouldn't you schedule your mammogram? I think like during your menstrual cycle or right before, because your breasts tend to be more sensitive. So I know I had a patient who told me that she had her mammogram done during her cycle, and she told me she wasn't going back to have a mammogram. She did. She told me she wasn't going back because I guess the sensitivity
painful.
of the breast during that time. But so I recommend that she would wait after her menstrual cycle to get her next mammogram.
Okay. And so after a mammogram, a lot of women get told that they have dense breast tissue. And so basically, most people don't know what that is. You're just like, because I have a lot of patients come in, they're like, well, I got a mammogram and said my breast tissue was dense. And I don't even know what that means. But anyway, so it's basically just saying that you have more dense tissue in your breast than the fatty tissue. And what does having dense breast tissue put you at risk for?
Breast cancer.
Yeah.
It puts you at risk for breast cancer. It does.
What's the reason?
It's because
it's harder to detect the cancer.
Yeah.
And so that and a lot of people that have it's actually very common to have dense breast tissue, and a lot of women that have it, they end up getting those false positive tests.
Okay.
And get biopsies and stuff done unnecessarily.
And usually once they detect that you have dense breast tissue, they may do a digital mammogram.
Mm-hmm. Yeah.
It's preferred than just the regular standard mammogram.
Yeah. Okay. And in the United States, that's the usual test that they do is the digital mammogram.
Okay.
So
symptoms of breast cancer. Of course, a single breast lump, which doctors may say mass. Some people get lump and mass, but they can go hand in hand. Breast pain, pain to the breast. Breast tenderness can be some symptoms of breast cancer. Nipple discharge. It can be clear, white, yellow, green, red, any type of liquid coming from your breast, and you're not breastfeeding. That's a red flag.
Yeah,
that's a red flag. Nipple inversion, meaning that your nipples are pressed in or not sticking out, especially if you have it on one breast and not the other breast.
Yeah,
that's a huge red flag.
And if you weren't born with it, then
yes. Changes in the skin of the breast. Pitting in the breast or puckering in the breast can also, redness of the breast can also be a red flag. So you do definitely want to contact your primary care doctor and go ahead and get that checked out.
Yeah, so basically if you notice any changes in your breast, other than, the normal changes that you experience whenever you're close to your menstrual cycle, then just notify your doctor and let them, make the decision on what you need to do next.
Okay, so B, I know we're big on preventative health, so please tell me, how to reduce our risk for getting breast cancer?
Well, if you have a baby,
okay, which we do,
then you should breastfeed. And as we talk about in every single video, exercise, eat healthy. If you smoke, stop smoking. And if you drink alcohol, decrease your intake. Okay. And that will help you reduce your risk of developing breast cancer. That'll help you reduce your risk of developing a multitude of things.
Okay. So I think we've summed it up.
Yeah.
Breast cancer. We're gonna recommend that you do get your breast cancer
screenings
done, especially if you can get it done in October. For those patients who may not have insurance, we're gonna be looking for some resources for them, so maybe they can get a free breast a mammogram screening this month.
So just stay tuned, and we will be posting on our Instagram and Facebook on places where you can go to get screened for breast cancer if you're uninsured or no to low income. And if you have any questions, just reach out to us, leave us comments, feedback below, and subscribe to our YouTube channel. Follow us on Instagram and Facebook
at BNB, the Community MPs, and remember that
community is our beauty.